And welcome back to This Week. Time now to get the views of our media and political experts. Carl Boyd Jr. joins us. He's a talk show host on WTST on the campus of Tennessee State University, and syndicated conservative talk show host Steve Gill. It's the battle of radio talk show hosts this morning. Appreciate you guys coming in and talking, as always, giving us your views. As we tape this on Friday, we still don't know what's going on with the health care reform aspect. The president wanted it approved. The Senate wants it passed by this weekend. Whether that happens or not, we're not sure yet, obviously. But one thing for sure, whether you're for or against this thing, it has been tossed completely up in the air, hasn't it?
Yes, it has. The problem with the health care is two problems. It's the Democrats and the Republicans. If you can get rid of those guys, then maybe we can get something done. But the real problem with the health care is that we do need a public option. Health care is a right, and every American citizen should have a right to have health care and afford it. The problem is it's so expensive that people cannot afford it. That's the reason we have over 47 million Americans that are without health care coverage.
The problem with this aspect, too, is the Democrats are now coming out opposed to it. We saw Howard Dean this week say that this thing should be killed and start over.
Yeah, you've got Howard Dean, you've got Keith Olbermann on MSNBC saying kill this bill. The Democrats are the problem. Republicans don't have enough votes to block this. It's the fact that the Democrats have looked at the polling in the United States. The American people overwhelmingly oppose this. Barack Obama's own Department of Health and Human Services on Friday disagreed with his clip earlier and said it will cost us more to do this bill than if we do nothing. It will not drive down health care costs. We will cut $500 million from Medicare. And I'll check my pocket version of the Constitution. I don't think health care is a right. And frankly, we don't have 47 million Americans who are uninsured, because about 11 million of those in that number that get tossed around are illegal aliens who are not here. And this health care bill, at the end of the day, again, according to Barack Obama's own Department of Health and Human Services, will leave 24 million or more Americans uninsured. This is not about health insurance. It's not about policy. It's about trying to give Barack Obama a win so he can make some announcement in his State of the Union address. That's the only reason they're trying to rush this thing through. And the American people need to say, no is the only vote.
That was kind of great.
Yeah, what the problem there with Steve, that the poll just come out today on Huffington Post says that 58% of Americans agree with the public option and the Medicare opt-in. So then, if our elected officials are supposed to be working for the public, then they should listen to the public. It is a right for American citizens to have health care. There's no reason why we should not have health care coverage when we are the richest nation in the country. Even poor Cuba, the poorest country in the world, have health care coverage for their citizens.
The problem, Carl, is that you're not getting into a little raft and swimming towards Cuba to get their health care. They're getting on rafts, swimming through shark-infested water to get here. Nobody's going to Cuba for health care. People come here from all over the world to get health care. The quality of our care will go away if we follow the path you're prescribing, and that's why the American people aren't.
Doesn't the president have some issues when his Alamo statement was that if we do nothing, it's going to cost us more, and now even his people are saying this bill actually may cost more?
But those are cover statements. The only thing the president is trying to do is assure the American public that he's doing all in his best to make sure that he can provide health care coverage for everybody. Now, what the Republicans are missing the point is that we should not have this many people in America without health care coverage. And that's the problem here. It's axiomatic what's going on. We need coverage for every American citizen. Now, the health care system is broke, but it has to be fixed. And the only way it can be fixed is through competition. Competition is good. That's the reason we have different grocery markets. So you can go in there and choose what you want from a different grocery market. You might find one item in one store different, a price at another store, and that way you can choose the best price. That's what President Obama is trying to do. But the conservatives will always argue, well, it's going to strip the private insurance company. No, that's not true. They made over $700 billion in the last 10 years, so they shouldn't be hurting for money at all.
Here's the problem with your analogy and President Obama's analogy, Carl. They're not wanting to go set up another Publix or another Kroger. You're wanting to set up the U.S. government grocery store down the street, and that's what Barack Obama's proposing. Government-run health care. That's why they keep calling it code names like single-payer and public option.
But you have to
government-run health care is what they're wanting, and we're not setting up government-run grocery stores because it doesn't work.
Senate Democrats want to get this bill approved, admitting that there are problems with it, saying, let's put it in conference committee, we'll work out the House and Senate version and get something out of this. Is that the way this should be organized?
No, we ought to follow the advice of what Barack Obama said on the campaign trail. It ought to be transparent. We ought to know what's in the bill. He was arguing it ought to be negotiated on C-SPAN, where people could see what's going in, what's going out. Right now, this bill is hidden in Harry Reid's office. Only a select few Democrats are only allowed to even look at what's in this bill. Coming out with something regardless of what's in there, rushing it to conference committee where they'll go behind closed doors with the House, come up with something, and then quickly rush that to a vote so that Barack Obama can wave it at his State of the Union speech is about politics, not policy. It's not transparent, and it's not honest.
But if it's left up to the Republicans, they'll sit on the sidelines and do nothing and then complain about not being involved. It's all about taking action now. And what the Democrats are trying to do, they're trying to take actions now because who knows what could happen within 3 or 4 years, because if we continue on this path, more people are going to stay uncovered on health insurance, and then the premiums are going to continue to rise while the private industries continue to make more money. That's the problem that we have, and that's the reason why people cannot afford coverage, because the premiums are so daggum high.
But that's the problem. Barack Obama's own administration says they will be higher with his plan than doing nothing. That's his administration.
But you have to do something.
That debate continues, and hopefully something will be done this weekend, one way or the other. We're going to find out by next week if there's a vote of the Senate proposal that comes together with the House version. Here in Tennessee, Governor Bredesen called a special session of his legislature for January to deal with education. This seems like a pretty logical idea. Change some of the requirements here in Tennessee in order to be eligible for $400 million. Some of those requirements mean that teachers will be more accountable, and some of his Democrats may not like this idea.
Yeah, what a horrible idea that we would actually hold those teaching our kids accountable for what they do in the classroom.
Based on a test,
and
is
you're
what
going
they're
to see
saying.
the teachers union opposing this as they're doing it in other states. The good news for Tennessee is that that's $400 million that will probably go into the classroom to help our kids, because I don't think the teachers union will have the clout to protect themselves at the expense of our kids.
Now, I agree with Steve on that. The teachers have to be held accountable because it's their responsibility to make sure the student receives the best education. So I do agree with Steve on that. The only problem with that is that you can't force the students to learn. So a lot of the teachers get the blame for some of the things that should be taken care of home with the parents.
Here in Tennessee also we had a couple of resignations or retirements from Congressman Bart Gordon and Congressman John Tanner. A little bit of a surprise, a little bit unsure that this was going to happen. So we got 3 U.S. House seats, open seats in the November of this year election. Unprecedented that I can remember when we had this many seats open.
You know, it is going to be a wild June and July because you've got all these primaries that are going to be taking place. The governor's primary, all these congressional races. You've got a state Senate battle for May Beaver's state Senate seat. A.J. McCall, Susan Lynn running there. You got a challenge in Doug Henry's seat. It is going to be so loud in June and July that people are just going to be seeing a commercial every time they turn on the TV, listen to the radio. It's just going to be all political ads. So I would encourage these candidates to be heard sooner rather than later if you want your voice to be heard.
GOP has the majority in both the House and the Senate here in Tennessee. Does this give them a leg up? Is it going to be tough for the Democrats to hold on to the 6th and 8th district houses?
Well, it depends on how the Democrats voted. If they supported Barack Obama health care plan and Nancy Pelosi, it's going to be very tough for them because a lot of people are upset with this health care reform bill. But on the other hand, if they can some kind of way swim through that, they may have a legitimate chance of keeping some of their seats.
You're right, too. There's going to be so much noise out there, it's going to be difficult to kind of filter your way through that.
It makes fundraising even more important than it already is. I mean, money talks in politics, but you're going to have to buy so many ads those last 2 months of the primary season just to be heard above all the sound and fury that's going to be going on. It makes fundraising even more important. So candidates that either can't self-fund or raise a lot of money might as well not even get in. These are going to be very expensive and very brutal races, and you're going to have Democrats and Republicans eating their own. I mean, these are going to be Republican and Democrat primaries, governor, Congress. They're going to be brutal.
State legislature.
Right.
They're going to make it good for us to watch.
Yeah, I agree with Steve on that point because whoever has the most money is going to come out of victory. So whoever got the most money should win the primaries and should win the election.
Or at least enough money to be heard. I mean, we saw in Virginia and other races, we saw in New Jersey, having millions and millions of dollars doesn't necessarily guarantee victory, but not having money guarantees you'll lose.
Steve Gill, Carl Boyd Jr., appreciate your insight very much. Stay with us. This week continues in a moment.